Hello and welcome to the channel where we discuss medical topics and lifestyle. Today's video is on vitamin B12 deficiency. So we're not going to go through metabolism and things like that. We covered that in another video. This is strictly the symptoms and the causes and some basic definitions of vitamin B12 deficiency. Let's get into it. So let's dive into some definitions. So what is vitamin B12 deficiency? What is anemia? What is a term called megaloblastic anemia? Things like that. So vitamin B12 deficiency, what actually is it? So it's a lack or shortage of vitamin B12. We won't go into what actually vitamin B12 does, so what the definitions of it. We covered that in the last video, but essentially vitamin B12 is a water-soluble nutrient. It's required to make healthy red blood cells. It's required for the support of brain health. It's required to make DNA. It's required to metabolize homocysteine and prevent something called pernicious anemia, which we'll talk about. What I would like you to focus on here is the fact that it makes healthy red blood cells and that it makes DNA. So that's very important in the way we describe what megaloblastic anemia is in a few moments. So vitamin B12 deficiency, it's a lack or shortage of vitamin B12. Then we have to talk about anemia. So what does anemia actually mean? What is the definition of it? Anemia essentially means that you have either fewer red blood cells than normal, or having an abnormally low amount of hemoglobin in each red blood cell. And the reason this all now comes together is because the red blood cells are the ones that have hemoglobin inside it, which go throughout our system. So having fewer red blood cells than normal, or having a low amount of hemoglobin in each red blood cell. And then when we pair this together, so we get a term called megaloblastic anemia. So megaloblastic anemia is abnormally large red blood cells plus an abnormally low amount of hemoglobin. So essentially what's going on here, the reason I said remember the DNA part is because we have impaired DNA synthesis because of a lack of B12, and then it causes the maturation of the nucleus inside the cell to be delayed relative to the maturation of the cytoplasm in the cell, the liquid jelly part in the cell. So that then results in abnormal red blood cells, and then we get anemia. The reason folate and B12 are often lumped together is because they can both cause this picture of a megaloblastic anemia. So that's important to keep in mind here, with the symptoms of B12 deficiency, because we talked about anemia and then we talked about B12 deficiency, and we can have symptoms in both. So we don't have to just be anemic to have symptoms, and we don't have to just be deficient to have symptoms. So what are the symptoms of B12? Well, it's quite vague and generalized. So there's extreme tiredness, lack of energy. There's pins and needles, sensations that we can feel. We can have a sore and red tongue. We can get mouth ulcers that develop. So again, keeping with quite a vague picture that can be paired up with many other illnesses and disorders. We can have muscle weakness, again, fatigue, psychological problems. So there's depression, there's anxiety. We can have vision issues as well. So that's very important here. And on top of that, we can have memory, understanding, judgment. These are all things that can be impaired. That general term of brain fog. So these are the symptoms of B12 deficiency. And how do we actually get to the bottom of it? So, well, we have to go see our doctor. We have to go see our general practitioner, family medicine physician. And in general, the most important thing to do in this case is a blood test to see what's going on with our vitamin B12 and other things. So that's the most important thing, because if symptoms persist, if things like this linger on for a very long time, they can actually become irreversible. You can get something called demyelination. So this can actually damage your spinal cord and your nerves. You can get ataxic gait, paresthesia, impaired vibrational sense. You can be really off, very, very off. So it's very rare that this happens, because B12 is one of the things you test for in general on a blood test. But it can happen. It can be irreversible if it lingers on for a very long time. And now we move on to what actually causes vitamin B12 deficiency. So a lack of these vitamins in your diet, so a lack of B12 in your diet, it's very important to keep that in mind. So a poor diet, that's number one. So sometimes alcoholics, things like that, people like that can have a very, very poor diet. Very restricted diet, so vegan diets, restrictive diets, these are all things that can contribute to having a deficiency of vitamin B12. And the reason for this is understanding where it actually comes from. So vitamin B12 comes from animal products. So it's synthesized by organisms and it's found in animal products. So that's why it's predominant to be seen in those kinds of diets. The second cause of B12 deficiency, another cause, is medication. So things like anti-seizure medications, proton pump inhibitors for gastric acid, reflux medication, things like that, because they can sometimes impair the absorption of these medications. And then we have malabsorption. We're a bit of a general term because there's a few things here, like structural issues, but malabsorption is one of them. So a lack of a terminal ileum, because that's where vitamin B12 gets absorbed in your small intestine. There's a lack of intrinsic factor, which is actually something called pernicious anemia, which is an autoimmune thing where we destroy the way we absorb vitamin B12, and infections and disease causing malabsorption. B12 is stored actually in the liver, and there's large reserve pools, so about 4 years. So when we do replenish it, it shouldn't be falling into a lack unless we're kind of falling into these categories of these causes of vitamin B12 deficiency. So that's the important thing regarding causes. B12 deficiency is actually more common in older people. It affects about 1 in 10 people age 75 and over. So it's relatively common, about 10% of people above the age of 75, predominantly because of the causes we mentioned above. And so we have something that causes a lot of vague symptoms that can become irreversible later on down the road. How are we actually treating this? So what's actually going on? We mentioned it a few moments ago about what the doctor is going to do, but let's go into it into a bit more depth and figure out what the actual plan is. So you go to see your doctor. The doctor figures out your history, all this stuff to see what's actually going on. Is it something like B12? Is it something else? So the first thing we're going to do is a comprehensive blood test, including B12 and folate, because they can paint that picture, like we mentioned. And then we have to see what's going on. So if the B12 is actually low, then we have to fix that. We have to correct that. The way to correct it is via injection. So into your shoulder and subcutaneously, you get an injection into the upper arm there, and it's a loading dose of B12. So you get an injection every few weeks, and this replenishes your stores. Then what should actually happen is that you should get another blood test, checking things out again, but also checking your intrinsic factor, because intrinsic factor, like we mentioned, is something that if we have a lack of can cause pernicious anemia, and that is a problem because if we have that kind of an issue, if we have pernicious anemia, then we need to be on lifelong injections. So that's as simple as that. If it's not pernicious anemia and it's not some other cause like medication or like having a disease like Crohn's disease or having a gastric bypass or not having our terminal ileum because we had an operation, then the answer will be supplementation. So you don't need lifelong injections. You should get by just absorbing it naturally, whether it be through supplementation or food sources and things like that. We're not going to cover food sources because we did it in another video. We'll link those below. But that is the treatment. So it's not just, okay, we don't have B12, we need injections forever, which is very, very common in healthcare practice in general. It gives people injections for no reason, and it makes them think there's something wrong with them, relying on injections lifelong. So this is the pathway of treating vitamin B12 deficiency. Nobody should be getting long-term complications from this. It shouldn't be becoming permanent, the symptoms in anybody, because it should be caught very routinely and very soon because it's part of the routine blood work that we do. And that's about it. So hope you enjoyed the video. Like and subscribe for more. It really helps the channel. Leave a comment in the section below, and we'll see you in the next one.